Hello, ladies and gentlemen. I'm Stuart Bishop. I'll be your tutor for this session of pathophysiology at Washburn University. This is the fall 2015 semester, and this presentation is specifically for Professor Sue Unruh's class. We're going to be taking a look at Module 2, and there's 5 units in this module, including topics such as stress, inflammation, the immune response, hypersensitivity, immune deficiency, etc. This is an extremely important unit, ladies and gentlemen. I can assure you, you will use throughout your career. So it really takes, it really benefits you to take the time to learn this material. You will see it over and over. And some of the aids that we're going to be using in this tutorial, of course, is the McCants book. I'm going to be citing a few pages in there that I think are really useful for quickly getting up to speed. I have a few drawings of my own, and then of course we're going to be primarily focusing on the class PowerPoint. I'm now going to turn the camera towards the monitor on the screen so we can follow the PDF for this unit together. Ladies and gentlemen, it will be really helpful for you to have your PowerPoint also open when we go through this material. Now, a couple of things I want to point out to you in the McCants book and the section on stress and disease, and I can't overemphasize this enough, ladies and gentlemen. Before every one of these pathophysiology units, you need to take a little bit of time out and revisit your basic anatomy and physiology. Before you talk about pathophysiology, or the study of bad physiology or pathetic physiology, we want to take a look at normal physiology and normal anatomy. What does the body do when it's healthy? And then in pathophysiology, we look at what happens when the body is not healthy. Okay, so if you open to your section on disease, or on stress and disease in McCants, a couple of things I want to point out here. This is very, very simple but important drawing here that shows you parts of the body that react in real or predicted stressors. And please make a note there about norepinephrine, and a note here about the release of CRH. CRH, of course, is a precursor compound that leads to the release of cortisol. Okay, so we have basically 2 compounds, or actually 3 compounds: norepinephrine, epinephrine coming off the adrenal medulla, and then CRH coming off the hypothalamus, and this CRH will then hit the anterior pituitary, which will release ACTH, and that will hit the adrenal cortex and release cortisol. And I'm going to actually show you a drawing here in just a moment that hopefully will clear that up. Now, also very important reading. This whole unit is important, but the unit here that talks about stress response, the central stress response, catecholamines, this is just really, really important to review that and familiarize yourself with it. Now, the other drawing I wanted to show you out of the book is this one. Now, when you first look at this, or when I first look at it, it's pretty intimidating. And you may think, oh my God, how in the world am I ever going to learn this? But I want you to see how simple it really is by going up to the top, and you'll see stressor. Okay, now that could be anything. It could be that bear in the woods. It could be somebody running after you. It could be something that you're afraid of that really isn't a threat to you, but you happen to be afraid of it. Okay, now notice that 2 things happen. When we have stress, we send a message to the limbic system, which is kind of in the central brain, and then the limbic system, then this is kind of the emotional center. It's not really the thinking brain, okay? It will then send a message. If it perceives this, this stimulus as stress, it will send a message to the hypothalamus, and the hypothalamus and limbic system in turn, and this is where it's really important, will send a message to the sympathetic nervous system and activate the nervous system. Everything in here in blue is nerves, okay? It will also send a message to the pituitary, which is the master gland of the hormone system, and the pituitary in turn will send a message through pathways in both the anterior part of the pituitary and the posterior part to do various things within the hormonal system. So, in response to stress, we're going to get a nervous response, which is primarily mediated by norepinephrine, which you will see here, and epinephrine, which you'll see here. And we will also get a response, so that's the nervous response, and then we'll also get a hormonal response via the pituitary to the, and the primary route for this is ACTH, because notice ACTH hits the adrenal cortex on top of the kidney, and then you release cortisol. So please make a note about cortisol. There it is right in the middle of all this. Okay. Now, a couple of important tables for you to look at. And by the way, I have a chart that I've drawn on my own which will illustrate everything we just talked about. Let me show you that right now. Maybe now's the time to introduce that. Hopefully this will demystify what we just talked about. Sometimes you got to really slow down and get back to basics. Okay, remember I said that one of the most important things you can do when you're studying any topic in pathophysiology is familiarize yourself with the basic anatomy that is involved and the basic physiology that is involved. And here I have a drawing. This side illustrates the nerves, illustrates the release of norepinephrine and epinephrine, and this side illustrates the hormones through the release of cortisol. Okay, this is real basic, and if you get lost anywhere, just come back to this slide and refamiliarize yourself with these pathways, and then you can move forward. Okay, so here is the alarm in both cases. And by the way, this is the brain, very poorly drawn picture of the brain up there. But let's say that this subject has been alarmed by something. In other words, they've been stressed. Okay, so the brain is going to release the brain is nothing but billions of neurons, okay? And the neurons release what are called neurotransmitters, and there's about 6 or 7 of them. There's norepinephrine, there's acetylcholine, there's dopamine, glutamate, serotonin, GABA, and probably a few that we haven't even discovered yet. But one of those neurotransmitters is norepinephrine. Now, if you are stressed, you are going to release norepinephrine from the central brain, okay, and that norepinephrine is going to act directly on certain target cells throughout the body, and we'll talk about what these cells are. These are cells of, we'll talk about those in just a moment, but also the norepinephrine neurotransmitter will travel to the adrenal gland, and it will go to the middle or the medulla of the adrenal gland, and it will stimulate the release of a very important hormone called epinephrine. Epinephrine will come into the bloodstream, as will norepinephrine will also be transmitted through the nervous system. And both epinephrine and norepinephrine will have cells throughout the body in various organs. And if that cell has a receptor for norepinephrine or epinephrine, that cell will be stimulated. Okay? That's just about how simple it is. Now notice, this is the adrenal gland, so we call these type of responses adrenergic responses because they are related to the release of epinephrine. And epinephrine, of course, the old name for it was adrenaline. Okay? Now, let's go over on the hormonal side, and if you have the same response, the same alarm, let's say it's that bear in the woods, you're going to be sending a message through your limbic system, through your kind of your emotional or your feeling system that says, hey, I'm in trouble. You will send a message to a very important organ in the brain called the hypothalamus, and the hypothalamus will secrete a compound called CRH, or cortico-releasing hormone. And it will secrete that down to an attached organ called the pituitary gland. And in this case, it's the anterior. The pituitary gland has two basic parts, anterior and posterior. And in the anterior part of the pituitary, if it's stimulated by CRH, it will release something called ACTH, or adrenocorticotropic hormone. Now, trophic just means building something or starting something. So here comes the ACTH down in the bloodstream. When it hits the top of the adrenal gland, the outside of the adrenal gland, or the crown, or what's formerly known as the cortex, when the ACTH hits the cortex of the adrenal gland will secrete this compound called cortisol. And cortisol then will flow through the blood, and wherever there is a cell that is receptive to cortisol, that cell is going to do something. And of course, we will talk about the many things that it does. Okay, so this is just kind of a simple view of this. So it's a little simpler view of it, but it is, between the two, I think you're going to really begin to understand. And of course, when we bring the PowerPoint in, it should all come together. Now, what are those cells? Remember that I showed that the norepinephrine and the cortisol will hit many cells in the body. And here's just some examples of the cells that will hit. It will hit brain tissue, cardiovascular system, pulmonary system, skeletal, liver, fat cells, skin cells, lymph system, and the immune system, or macrophages. You can see this is a very widely dispersed effect. Also up here are some of the other effects of the adrenergic receptors. Remember, we have that term, adrenergic. It just pertains to cells that respond to epinephrine and norepinephrine. And we have basically four types of receptors: alpha 1, alpha 2, beta 1, beta 2. And you can read through these, and of course in the PowerPoint we're going to be talking a lot more about those. But just to go back here, these receptors that we're talking about here are either, depending on what type of cell this is, are either beta 1 receptor or beta 2 or alpha 1 or alpha 2, okay? Depending on what type of tissue it is. It's just that simple, ladies and gentlemen. So I hope you're breathing a sigh of relief. This isn't as complicated as you might think. Now, on the cortisol side, this over here relates to what are known as catecholamines. And catecholamines are just a category of stress compounds, and they include primarily norepinephrine, epinephrine, also dopamine. Those are your main catecholamines. Now, over here on the effects of cortisol, you can see what the physiological effects of it are on various different tissues in the body. Okay, these are the really important things for you to familiarize yourself with out of McCants. As far as I'm concerned, I would say familiarize yourself with that to start with, and then you can delve into the remainder of the chapter, and it should make a lot more sense to you. Okay, at this point in time, ladies and gentlemen, let's go to the class PowerPoint, and we're just going to roll through this. And the first, of course, this is the stress of PowerPoint. The first slide shows us Dr. Hans Selye, an absolutely brilliant guy. He is known as the father of stress, but he did a lot more. Just a real pioneer in healthcare, and he studied rats that were under stress, and he began to see that there was a common pattern that developed, and he called that the generalized adaptation system, or GAS, and we'll get into that in just a moment. Now, it's important to notice that stress is really what you think it is. You may be very scared of a bear in the woods. Let's say that I'm a hunter and I go out hunting bears. I'm not going to be nearly as scared. I might be a little bit excited when I see one, but I'm not going to be nearly as scared as somebody that has no experience. So it really comes down to your perception. In other words, how your brain perceives things. And remember that the perception, a lot of that goes on in the non-thinking brain, in what's known as the limbic system. So write limbic system down there, because that's the area that kind of perceives whether something is a stress or not, okay? And what happens when we get under stress is that we get out of what is known as homeostasis. Homeostasis is that kind of that middle point where we're not too relaxed, but we're not too excited either. We're just sort of right in the middle. But if we get stressed, we're going to become very excited. And also keep in mind from your study of anatomy that there's two sides to the autonomic nervous system. This is the nervous system that beats our heart, helps us breathe, regulates our pupil dilation, etc. And this system is automatic. It's done for us. We don't voluntarily tell our heart how much to beat. It's done automatically for us through the autonomic nervous system. And that system has two sides, the sympathetic side and the parasympathetic side. And you can think sympathetic stress, they both begin with S. So if you are under stress, you are going to activate the sympathetic side of the nervous system. And that's that side that you saw in the book with all the blue and the norepinephrine and the epinephrine. Those are all known as sympathetic responses when they are elevated. Okay? And that takes you out of homeostasis and into stimulus or into stress. Now, the other side of the autonomic nervous system is called the parasympathetic system, and that's the one that helps us rest and digest. It helps us calm down, and that's the other side of homeostasis. But in the middle, between stress and relaxation, is homeostasis, which is kind of quietly alert, if you will. Okay? Now, next slide, psychoneuroimmunology. This is a really important term. The psycho is the perception, or the individual, the brain. The neuro is that neural channel that we saw with the on the blue side with the norepinephrine and the epinephrine, and also the endocrine side, which would be the cortisol. Now that would make this word too long. We'd have to go psychoneuroendocrine. It would be too big, so we kind of leave endocrine out of the word, but it's certainly there in terms of the response. And we find that the stimulation of the sympathetic nervous system and the response to stress can affect our immune status, and we'll get into that in just a moment. Okay? Big word, an important word. Now again, we have that the stressor is anything you perceive it to be. And as a matter of fact, one of the biggest stresses that students have is tests. And we have found that when students are approaching a very important exam, their immune system will go down, and oftentimes they're susceptible to colds. And that is because, as you will see, when we are under stress, one of the things that happens is we tend to have a sort of a depleted immune system, and we'll talk about how that is in a moment. Now, Dr. Selye, came up with what's called the GAS, or the General Adaptation Syndrome, and he discovered that there are three symptoms that are almost universal in the animal kingdom. One is that if somebody is under stress all the time, the adrenal cortex is going to be hypertrophied or enlarged. The thymus gland, which is a very important gland in the immune system, will shrink. You can imagine what that does to your immune system. And then also we see an increase in ulcers of the stomach and the duodenum in the small intestine. So we see these three symptoms over and over. And one of the reasons that you will see the hypertrophy of the adrenal cortex, of course, is that it's just constantly stimulated. And if you constantly stimulate some tissue in the body, it's going to tend to get enlarged, but not necessarily in a healthy way. In this case, in a very unhealthy way. Okay. And this general adaptation syndrome has three stages. One is the initial alarm, and we've all had that where we're kind of startled or surprised. The next session is the what we call resistance or adaptation. So we resist the stress. So the way we would resist the bear in the woods is we would take off running. Or we either do that or we adapt to the stress, one or the other. But if we do neither, if we can't resist the stress and we can't adapt to it, if it just continuously alarms us, eventually we get to a stage of exhaustion or burnout. And for example, in the adrenal gland, the disease associated with that is Addison's disease. You can think Addison's adrenal, basically the burnout of the adrenal system, because it's just been overstimulated. Okay, now the first stage in stress is the alarm stage, and it is an emotional response. And initially we may just feel a little bit anxious about it and so forth, but if it really becomes intense, we can actually perceive danger, something that is a threat to us. And under those conditions, we're going to have the release of cortisol and adrenaline. And remember, adrenaline is just another word for epinephrine. And the more intense the threat, the greater amount of this stuff is going to be secreted. And of course, when this stuff is secreted, it's going to then get into the bloodstream and it's going to start targeting certain cells. That's the important thing. And it's going to target on the nervous side, or the epinephrine and the norepinephrine. It's going to target what we call adrenergic receptors, and then for the cortisol, it's going to target receptors for cortisol. And of course, these receptors will be basically 4 types: alpha 1, alpha 2, and beta 1 and beta 2. We'll talk about those in just a moment. Okay. And ladies and gentlemen, the whole key to all of this is to get a foundation. So that hopefully in the last 5-10 minutes we have given you that foundation for understanding all this. And if it gets ahead of you a little bit, just come back to what we're talking about here, and you will refresh your memory and you'll be able to continue to build on it. Okay, the alarm stage, again, if this alarm gets bad enough, we're going to stimulate a neuroendocrine response. Remember, the neuro side is going to be norepinephrine, and that will then go down to the adrenal medulla, down into the middle of the adrenal gland, and release epinephrine. And then the endocrine response is going to be the hypothalamus sending a message to the pituitary to release ACTH. The ACTH will go down to the adrenal gland, to the crown or the cortex, and release cortisol. Okay? That's your neuroendocrine response. All right, now here's a picture of it. Again, we have the stressor. It comes in, it hits the brain, and that's going to stimulate what we talked about, the sympathetic nervous system. Okay? If the sympathetic nervous system is, and remember, that's the side of the nervous system that gets stress. Okay, gives you the fight or flight response, and that signal will then signal the release of catecholamines, which is a category of compounds that includes norepinephrine and epinephrine and dopamine, I think a couple of others. But the primary one that we're looking at is the release of norepinephrine. And keep in mind, this is a neurotransmitter, very important neurotransmitter. Okay? Now, norepinephrine will travel down to the medulla, or the middle of the adrenal gland, and at that point it will stimulate the release of epinephrine. Now, it does this through something, you probably don't need to know this, but there's a nerve called the splanchnic nerve. And that's this nerve right here that carries the, and it's what we call a noradrenergic nerve, because it secretes the neurotransmitter norepinephrine, and that nerve will terminate in it goes right down into the medulla of the adrenal gland, and then it will stimulate the adrenal gland to secrete the hormone epinephrine into the bloodstream. Okay? Now, this is just giving you some information about norepinephrine and epinephrine, and notice that norepinephrine will excite mainly the alpha receptor. So when you think of alpha, think norepinephrine. Okay? A comes before B, and norepinephrine comes before epinephrine. So just kind of think it like that. Norepinephrine, kind of think more of the stimulus of the alpha receptors. Epinephrine will stimulate both alpha and beta. Okay, now, what are the effects of this? Now here we have adrenergic receptor stimulation. Okay, again, let's come back to our picture. here are our receptors. Those are the receptors. And these could be alpha 1, beta 1, alpha 2, beta 2, or even beta 3, which we probably won't talk about a whole lot. But notice that the, and this is a generalization, but your alpha 1 receptors tend to be in smooth muscle, and they tend to stimulate the muscle to constrict. Also in the liver, the alpha 1 receptors in the liver will stimulate glycogenolysis and gluconeogenesis. Now, glycogenolysis is just the breakdown of glycogen. Glycogen is a sugar that is stored in the liver. And when we stimulate the liver to lyse that or break it down, that's going to release glucose in the bloodstream. And we will also stimulate the liver to make new glucose, gluconeogenesis. So the effect is to create quite a lot of additional glucose into the bloodstream. And why would we need that? Well, we want that extra glucose because we are under stress and we have to run away from the bear in the woods. And so we're going to need to have the glucose so that we can create ATP, so that our bodies will have enough energy to do what they need to do under stress. Now notice, normally this isn't going on at this level. But when we get under stress and we get startled, the body will send this message and will just start spewing out the glucose to give us plenty of energy. We'll get back to alpha 2 here in a moment. Now the beta 1 effects, beta 1 affects the heart, the tissues of the heart. It will increase your heart rate and will also increase the force of your heart contraction. Now the rate is known as a chronotropic effect or a clock effect, and the force is known as an inotropic effect. So you might see those two terms, chronotropic, inotropic, that's what they mean. But in both cases, you can see the combination of that's going to mean the heart's beating more and it's harder, so it's going to be pushing out more blood. Again, so that all of the cells in your body have plenty of oxygen and and it will be carrying this glucose so that your body will have plenty of the energy that it needs to keep going. Now, the beta 2 effect, we see this a lot in the GI tract and also in the bronchial tissues, is to relax those, to open the airways. So we open the airways with beta 2, and we also relax the intestinal system. Now, what does that do? That means that we're not doing as much digestion right now. And this makes sense because when we are scared, we don't want to spend our time digesting. We want to spend our time with our large muscles, running, we want to, and all this sort of thing. And so we divert what the body does, okay, for a little while we deal with the stress, okay? And at the level of the kidney, we are going to release something called renin, and the renin is part of the RAS system, the renin-angiotensin-aldosterone system. So you go from renin to angiotensin to aldosterone, and what that does is basically retains fluid. So if we're scared, we don't want to be bleeding out, and the same response would occur. Let's say if I cut my arm, I would become very scared, and so I would tend to retain fluid, and so that's the effect of that. Also, at the level of the liver also has beta 2 receptors. Again, that's going to give us more glucose into the blood. And let's go back to alpha 2, which is really important. Notice that alpha 2 inhibits the release of norepinephrine. And this is really an important idea here, ladies and gentlemen. So here's our basic receptors. So we've become stressed, we've seen the bear in the woods, we've secreted the norepinephrine, it's coming down, it's hit the adrenal medulla, it's spewing out epinephrine, and these various cells of the heart, of the bronchus, the GI tract, the kidney, the liver, etc. are all being stimulated. But now we have to turn this off. So how do we turn it off? Well, we go to the alpha 2 receptors, and we will show you where those are in a moment. But the alpha 2 receptors will begin to turn this thing off in a kind of a feedback loop. It says, okay, I have enough norepinephrine, I don't need any more, let's start calming down. Okay, now that will be overridden if the stress continues. So if the stress continues, this alpha 2 will be overwhelmed, and we will continue to have alpha 1, beta 1, and beta 2. But if if the stress has gone away, then the alpha-2 receptors will block the further release of epinephrine, and eventually the body will start to calm down. And this is what we call a negative feedback. That, hey, I have enough norepinephrine and epinephrine now, we can start to shut this down. I'm no longer afraid. But if I continue to be afraid, I will continue to get more and more secreted, and I will overwhelm this stimulus, and we will continue to remain in stress. Okay? Now, again, the writing here will just give you more information on the two major classes, alpha and beta receptors. And of course, we have alpha-1, alpha-2, beta-1, and beta-2. Okay? That we're going to focus on today. Okay, now, what about alpha-1? The main effect of alpha-1 stimulus is on smooth muscle. So this would be alpha-1 will hit cells that are part of smooth muscle in certain organs of the body. Okay, and that will cause that muscle to constrict. Okay, we'll take a look at that in a moment. Okay, a couple of the areas where it does this is in the arteries, veins, the eye. Now, when the eye muscle constricts, it actually opens the pupil. Okay, the skin, the GI tract. And when we constrict the sphincters in the GI tract, we slow the flow there, and so on. And also, again, the effects in the liver. And you can read through what those alpha-1 effects are and what areas of the body that they affect. Okay. Now, the next one, again, this is all part of the SNS, or the sympathetic nervous system. Notice that there is a little bit of a difference between alpha-1 and beta-2. Okay, alpha-1 is going to constrict the blood vessels, but beta-2 specifically dilates the coronary arteries. Okay, so what's happening is we are getting an overall constriction of the blood vessels, but we are getting specific areas that are actually being opened up. So the body is saying, I don't want the blood on the superficial part of the body. I want the blood flowing to the vital organs. So that's how this balances out. Because sometimes alpha-1, alpha-2, beta-1, beta-2 will have contrary effects, and it just depends on which one is the stronger as to what the prevailing effect is going to be. Okay, now also alpha-1 will reduce the urine output of the kidneys. So one of the things that the body really wants to do when it's under stress is preserve fluid, preserve blood. And this is one of the ways that it does that. Another alpha-1 effect, very important, is to, because it vasoconstricts the smooth muscles of the blood vessels, it's going to give us an increase in blood pressure. Okay, very important. And this is why we use alpha-1 agonists to treat patients that are in shock. Shock is just simply where the vessels